Okay, so for today's agenda, we're going to talk about how to get support from um, different professionals. Then we will have to discuss about know your child's needs, then consider all the options for school and how ABA, BB, and ABLES can help, okay? So of course, most parents, what we want is for our parents to be happy, to be able to take care of themselves, to be able to make friends, and of course, to go to school and learn how others learn as well. Okay. That's why it will lead to the question, is my ready for mainstream? Okay. The most important part for our kids is to be able to have the language skills, the social skills, to have attention, especially if you're in school wherein there are more than 10 to 20 students inside a class with one teacher, and then are they physically healthy to attain the class? Are they ready for the academic skills? Of course, we know that the curriculum varies from different ages, and what do you call this, those academic skills are very important as well. And then of course, can they have emotional regulation skills? And of course, the most important skills also to learn is, can they follow instructions? Okay, so these are the skills that we need to answer for us to tell if the child is really ready for mainstream class. Okay. For us to know if your child is ready, of course, we need to know what are the strengths and areas that the child needs to improve. Because basically, different children have different skills, strengths, interests, and of course, areas of needs, okay? Some child might need additional help and support to adapt in a different environment, especially in a mainstream school or in the school itself, okay? So there are different areas under communication skills. The number one there is, can they make the request? Can they even say their basic needs? Can they say that I need to go toilet? Or if the notebook is left behind at home, can they be able to request for that one? Okay, and then can they also initiate and maintain a conversation as simple as saying hi, hello, and then if someone or if your classmate asked you how are you, can you be able to answer that question as well? And then of course, one of the most difficult areas to teach also is the understanding the nonverbal communication, meaning if like for example someone keeps on talking and the person keeps on looking at the watch, it only means something, that probably the person is busy, or the person is in a rush, or probably if you keep on tilting your body, it might tell you that the child is not ready to communicate with you. Okay, so that's one area of the communication skills. The next one is social skills. Can they cooperate with adults and peers? So it includes also the following of instruction by the teacher. When the teacher says, okay, get your science notebook and turn to page 5. Will they be able to cooperate on that multiple step instruction as well? And also for peers, when peers say hi, can they respond? Or if the peer says, let's play, how can your child react to that question? Okay. The next one part of the social skills as well is turn-taking skills. Can the child be able to wait for their turn and not always think about themselves? So that's one crucial skills under social skills as well. And then initiating and maintaining friendship. So of course, there's a different areas of how are you going to initiate to make friends, and also how to maintain that friendship. Okay, so that's part of the social skills. The next one is academic skills. So what are the pre-reading skills? Of course, your letters, your numbers, basic sight words, and decoding of words are part of academic skills. Writing skills, they can they, what do you call this, write their name when asked to do, what do you call this, worksheets, or can they copy from the board, wherein they will copy the assignment that is written. And then the last one is numeracy skills, which includes the addition, subtractions. So those are academic skills. Now, part of the cognitive skills are attention and focus. Like for example, if the teacher gives a story or tell a story, would they be able to attend and focus what is being said to them? Okay, and then also memory. Can they remember what the teacher talks about and was able to carry over whatever lesson is given? Then also part of the sequencing skills wherein can they be able to like for example, the stories was given, can they be able to know which one is the beginning, the middle, and the ending of the story as well? Can they relate the story together to make the whole picture? So that's part of cognitive skills. And then the next one is motor skills. So part of it are the gross motor skills and fine motor skills. Of course, we all know that gross motor skills are those bigger muscles movement. The jumping, crawling, skipping, hopping, those are gross motor skills. The next one is the fine motor skills wherein it involves the writing. Okay, so more finer muscles involved with that one. Then the last one is emotional regulation. Okay, under emotional regulation, it includes flexible to changes and transition. We all know that in schools they have different subjects. Are they willing also to transfer from one class to another? Meaning they will start in their own classroom and sometimes they will go move to the gym to have their PE class, or move to the what do you call this common area wherein they will have a story time or something. So it's more of like, are they flexible enough to have those changes and transition? And then also manage emotions independently. So like for example, how are they going to react if there are some changes? Can they cope up if someone, what do you call this, trying to bully them? That's very important. So it's one sensitive issues now in schools wherein most of the kids who have disability have difficulty in adjusting with other kids, especially if they're trying to bully them. So we need to teach them also those emotional regulation aspect. Okay. The last area is empathy towards others, because most of our kids, they only think about themselves. It's seldom or it's difficult for them to see the other's perspective, like how does the other friend feeling when they are hurt, or like for example in simple games like the turn taking game, will they be able to understand that the students that we have with special needs keeps on thinking about themselves and without realizing that they're not giving chances for others. So overall, these are the needs that we need to check. So what are the strengths and weaknesses of the kids that we have before we consider them putting in school? Okay, next one. So in line of that one, so of course, the first step towards understanding your specific or child-specific needs is you need to find a qualified professional. So who are those qualified professionals? Of course, we have doctors and psychologists. Okay, so there are different types of assessment. Okay, we have the psychological assessment and the educational assessment. I think Sara will be able to help me later on when it comes to psychological assessment, or Sara, maybe you can give some background about psychological assessment.
Yeah, sure. So like Sharon said, there's the educational assessment and the psychological assessment. So in terms of the psychological assessment, there are many kinds, but for a child who is graduating from preschool and going into big school, an IQ assessment is helpful to decide whether your child is suitable for mainstream, will be able to cope with the academic demands. The main thing an IQ assesses is cognitive ability. It's not that you pass or fail an IQ exam, but when you get a higher IQ, it implies a higher functioning child in terms of cognitively higher functioning, and a child or any person actually who gets a lower IQ would be cognitively lower functioning. And in Singapore, special schools, you can join a special school based on IQ. So they take in children into their special schools. One of the criteria is the score, the IQ score. So that is why it's important to take an IQ assessment if you're thinking of a special school. If it's a mainstream school, an IQ assessment is actually not required. Okay, I'll hand it over to Sharon again.
Yeah, thank you for that, Sarah. So basically, as Sarah mentioned, right? For if for example, it depends on what school are you going to get into, wherein they might be needing the psychological assessment. Okay, but of course, one of the important assessment as well is the educational assessment. Okay, so basically, educational assessment, it's more of checking the academic readiness of the kids, like how they get the skills, how they acquire the skills as well. So one assessment that is available is what we call the ABLS, Assessment of Basic Learning and Language Skills. So basically in ARN, we are using ABLS to check where is the what do you call this, the current level functioning of the child, because knowing that one will make a difference if they are really ready for school. So okay, so those are the types of assessment, because later on I'm going to discuss more about the ABLS. But so other analysis also can include medical records and some school records, or maybe the early intervention reports that they have before they really go into mainstream school. Okay, so when we move on to the next slide, yeah, so this one is a sample of the ABLE. So basically, a typical 5-year-old should be able to fill in all the squares in the ABLE. So again, what do you call this? ABLES is an sample of the educational assessment. And it also provides a normative data. What do you mean by that one? Those normative data will compare with, I mean, the normative data is compared to a typical developing 5-year-old kid. Okay, there's a study that these are the skills that are really useful. And we know that when you have this skill, chances for you to survive in the mainstream school is higher, because the basic skill you're able to achieve it already. Okay, so the ABLES have 544 skills that you need to have. Okay, that includes different areas. We have 25 areas. Later we will discuss those areas as well. But in summary, it includes the language, social interaction, self-help skills, academic skills, and motor skills. So when we go back to the previous slides, right, it will tells you that this assessment will have a clear picture if they are ready for mainstream. Okay, so if you want to know more about the assessment using the ABLES, we'll be happy to help you. And towards the end, you can ask more questions about it. Okay. So yeah, when we're talking about the ABLES, right, so it has 12 critical areas that needs to be developed if you'll be ready to school. So cooperation and learner readiness, that's the first one. Next one is visual performance. Visual performance are basically activities that involves you for the child to scan, like for example, puzzles, sorting, sequencing activity. Those are under the visual performance, or the block imitations or the sequence pattern. So those are part of the visual performance skills. Okay, the next one is receptive language. Receptive language means is the child be able to answer the questions given to them, I mean following the instruction given to them. Like for example, if I say, Sarah, can you touch your nose? Good touching your nose. So basically, can the child understand the instruction, and the child will respond to that instruction. Okay, motor imitation, it means that if I do this, will you be able to, or the child will be able to do it. Good job, Sarah, for waving your hands. Good following. Okay, the next one is vocal imitation. So there are some kids who are having difficulty with articulation, or some of kids doesn't have communication skills, right? So we will start first with the echoics. Can they what do you call this, imitate different sounds, different words with blends? Blends meaning if I say brush, chair, spoon, those are blend words. Okay, so can they imitate sentences? So those are part of the echoic skills. The most important areas, the area is also demanding, or what we call requesting. As mentioned before, it's more of like, will the child be able to say their own request for their basic needs or the items that they'll be needing at that moment. Like for example, asking for pencil or asking for sharpener if the pencil is broken. So that's part of a manding activity. Also, one of the advanced manding skill is, can they ask questions? Like for example, they are presented with a known item. Can they ask, what's this? Or where is, asking for people who are not around. So those are the advanced man skills as well, okay? Then the next one is tacting or labeling. So for example, if I put an item in and I ask, what's this? Will the child be able to answer the item that I'm asking, okay? So that's labeling. The next one is interverbal. So basically interverbal are skills that when you talk about things in their absence. So for example, Sarah, what did you have for lunch?
Had rice and curry.
Oh, that's nice. Okay, so that's a sample of an interverbal. So basically, interverbal skills are the start of like a conversational skills. So of course, most parents would like to know what did the child do in school. Like, what did you do in school today? So those are important questions that you want your child to answer as well. So it's part of the critical areas that they need to develop. Okay. Then we all know what is social interaction, play and leisure, group participation. So basically this one involves not only about themselves, but to, to play with other people as well, okay? And then the last one is functional living and self-help skills. So overall, these critical areas are really important if you want the child to be successful in school, okay? All right, so other than those skills that they need to be able to have or to develop, we also have other critical behavior patterns to be developed. Of course, the child should be calm, flexibility with respect to the routines, they can sustain focus and attention. We all know in school that when the teacher gives an instruction, it will last for 30 to 40 minutes, like for example, talking about a lesson. Can they sustain that attention? So if they have short attention span, they might have problem, you know, so it's something that we need to develop as well. Okay, of course, joint attention, spontaneity. Okay, spontaneity meaning it's not enough to just ask, I want to eat, but what if, or I want to go toilet, but what if the teacher is not paying attention? So how spontaneous they are or how persistent are they going to give their request as well? So it's very important. Fluent responding, okay, it's not enough they know the skill, they need to generalize, and if they are asked to show that skill again, are they able to display that skill? So they need to be fluent in the skills that they learned as well, okay? Then as I mentioned, the persistent responding as well. So overall, these are the critical behavior patterns that the child needs to develop beside the critical skills that they need to have. Okay, so imagine how difficult for our child and how many skills that they really need to master. Okay, so of course, if we know already that what the child's need, we need to now have an IEP. So basically an IEP is an individualized educational program wherein we need to know, we will set goals and objectives and how are we going to reach that objective to be able to know what are the targets that we're working on. I know that, most one-on-one, they have the IEP. Even if they join the school, the mainstream school, they also have what we call an IEP because it's important that we know the child's need because not all kids are the same. So as I mentioned, right, they have different skills. They might have, different ways to adapt on how to master a certain skill. So it's really important that we have an IEP for these kids.
Okay. All right, I'll take over from here, Sharon. Thanks, Sharon.
Thank you.
Yeah, so as I mentioned earlier, so for educational placements, after EPIC, so that is, let's say your child is going to a preschool or an EPIC right now. So we need to do an IQ assessment if you're interested in enrolling your child in a special school. Most special schools in Singapore need an IQ score, and they have a criteria. So, like for example, Pathlight School, which some of you may have heard of, is the only school in Singapore which accepts children with a diagnosis of autism, and they prefer, an IQ which is above 70. So they keep that in mind, not that it's the only deciding factor. Of course, if you get an IQ of, let's say, 90, but you're not able to show that you're able to adapt to academic demands, your child may not get into Pathlight. So IQ is not everything, but it's one of the factors that these special schools consider. And it's not just Pathlight, the different schools have different criteria. Some schools prefer a child whose IQ is between 50 and 70. And some schools it's above 70. It varies from each school to the other. And as I said, if you're enrolling your child to mainstream school, it's really not necessary to get an IQ score. But usually when your child is graduating, if your hospital where you go to, the pediatrician you see, might request for an IQ assessment just to get a better understanding, so that you as parents have a more informed decision. Is my child ready for mainstream? Will my child be able to cope with the cognitive demands at mainstream? So even if you're enrolling your child in mainstream, your doctor might ask you or schedule an IQ assessment with you. So these two areas, cognitive functioning and adaptive functioning, are assessed. When you go through a psychological assessment, it can be done at a hospital like KKH or SGH. It can also be done privately in a private center which offers IQ assessments. It's usually done by a psychologist, a registered psychologist. So basically, when you're thinking of, like, your child is turning 6 years old and you're thinking, what's next? Where should my child go? Which will be the most suited educational placement? The main thing is to do your research. You know your child better than anybody knows your child. So the main thing you need to consider is my child ready for the demands of mainstream? If you do think it's mainstream, then find out about the schools close by and also learn more about the support available, because fortunately in Singapore, mainstream schools do have support. They do have people called allied educators who do give support, but do your research as to how much support is there, because in some mainstream schools, it's just one allied educator. So be realistic, like how much can one allied educator really help your child? But there are different options. There is shadowing. You can have a shadow teacher. If you feel your child can cope but may need a little help, then yes, sure, you should go to mainstream. But if you feel, no, not really, my child is 6 years old but not able to read, not able to write, not able to pay attention or follow instructions in a group setting, then it would be wiser to go for a special school which will have a smaller class size, only maybe maximum 8 to 10 children in one class. And plus, the teachers are trained to deal with children with special needs. So obviously, your child will be more suited to go to a special school. So keep everything in mind. And of course, it's a difficult decision. Every parent wants their child to go mainstream school. Every parent wants that. But then we also need to consider, is your child going to be able to thrive in a mainstream setup, or will your child be completely lost and unsupported? So you need to really consider the pros and the cons. So yeah, like I said, this is just what I discussed. Find out from also the teachers, preschool teachers, or if you therapists who are working with your child, as to what you think will be a better recommendation. Would mainstream work better, or would Fed school work better? Because we know mainstream schools in Singapore have a lot of academic demands. Academic demands are quite high. So when you look at the pros and cons, I mean, of course, there are advantages to mainstream schools here. The child will interact with neurotypical peers, learn new skills, get a lot of exposure, get to know a lot and learn a lot, and is able to access mainstream curriculum, will be able to take PSLE. So all those are very, the advantages. But on the other hand, we need to also consider there's minimal one-on-one instruction or minimal one-on-one support. So it'll be like a class of 30, sometimes even more children, and 1 or 2 teachers. And so obviously it's a bit hard for the teacher to give one-on-one attention to your child. So will your child be realistically able to cope with that? Like when the teacher just says, turn to page 45, go to question 10 and answer the question. There are so many multiple instructions being given. Is your child going to be able to follow through with those instructions? So that's what you need to ask yourself and observe your child and find out. There's minimal teacher to student support because the ratio of teacher student ratio is high, and the child might find it challenging to keep up with the class. So those are the disadvantages. So moving on, this is what I spoke about just now. So it's going to be a big class and 30 minutes per lesson. So the child has to be able to maintain attention for 30 minutes. And it's a long day. It's like 7:30 to 1 p.m. It's not like preschool where it's just 3 hours. So these are considerations. The child has to be able to sit throughout the session, switch between activities. That is, maybe they are working on, let's say, art, and then suddenly the bell goes and then it's like PE. So the child has to be able to understand, oh, art is finished, I have to pack my bag, now I have to go PE. Sometimes they may need to change their clothes. So all this, the child has to be able to manage independently. Yeah, this is what, just repeating myself. So basically take care of their belongings, go to the canteen independently, buy food, move from class to class, being able to transition, follow instructions in a large group setting. So of course there is support, like I mentioned, in Singapore mainstream schools. There are teachers trained in special needs. There are allied educators. So allied educators are basically, they are teachers who have been trained in either learning and behavior support or counseling. So if you're interested in enrolling your child to mainstream, find out if there is enough allied educator support. So I would definitely personally recommend, if it's only one allied educator, that's really not going to be much of help. Some schools have more support. They may have 5 or 6 allied educators. Obviously, that would be a better school for your child if you want your child to go mainstream. Then there are also, of course, teachers who are more, who carry out remedial classes or pull-out classes. So if they find out, like in P1, when your child joins, they will assess your child. And if they feel your child is all right in English, but in math, your child is finding it hard, they will request for a remedial class or a pull-out class. So these are some of the questions you just need to consider. What can my child cope with? What do the professionals working with my child feel? Is the school able to support my child? Although there's a very important decision, it's not like the last and final decision. Let's say you put your child into mainstream school and then your child is unable to cope, finding it very hard and struggling. It is possible, and I have seen cases where the child is not able to cope, so then the parents change the child from mainstream to a special school. I've seen the other way around also. So they start off with special school and then they feel the child is all right or getting better in his skills, and then they've tried transferring the child to a mainstream school, although the second case is much fewer. It's usually the other way around. So the main thing is follow the pace of your child. Of course, we all have goals for our child. We want our child to thrive and do well. But it's important to be realistic and understand, will my child be able to cope? If the school is able to provide that support, extra support, then of course, sure, we will always encourage. We are not discouraging that. But then it should not be a place where your child is struggling. And your child should not just survive, but thrive, enjoy school, learn obviously, it's not only about academics, but to be able to thrive and to be able to manage. That's what will decide whether you should go SPED or a special school or mainstream. Yeah. So these are some of the points to keep in mind. Your child's strengths and difficulties, your child's cognitive functioning. Of course, P1 and P2 now, as you may know, there are no exams. But as the level goes higher, P3, P4, suddenly there is an academic jump. Like, the demands are much more and the child is, the expectations are much higher. So at that time, will your child be able to cope? So that's what you need to keep in mind and consider. Of course, keep in mind your child's needs as well, any medical conditions or any concerns your child might have. This is a very good resource. You can look it up. It's on the MOE website. So the MOE website is a very good resource for, they have information about mainstream schools and about special schools. So I would say you should go through this if your child is graduating. Okay, now we have a video which I'll just play.
Scientifically researched data from the ABLES are a child needs 544 developmental skills in preparation for mainstream enrollment. One-to-one therapy can provide effective and continuous development to a child with autism. How your child acts in public does not fully represent their behavior. Center-based therapy is only one half of the solution, which is why we also provide home-based therapy. In home therapy, we'll send your child's therapist to your home, where they'll conduct regular lessons and activities. Your child gets to learn in their natural environment, and they don't have to stress about meeting new people or places. Meanwhile, our therapists get a chance to understand your child's behavior at home, spotting negative behaviors that are otherwise not displayed in public. Obviously, we can show you their challenges firsthand, but our therapists can also show you what to change in your home environment so that you can help your child correct negative behaviors and learn better during sessions. Besides that, your whole family gets to take part in your child's sessions. Both parents and siblings better understand the child's needs and together learn the techniques and activities we use. Ultimately, parents want their children to grow up and live life independently. So, we can teach your child activities of daily living at home. It is very important for parents to understand that a combination of both home-based and center-based therapy is the most effective approach, as they each have their own strengths. Therefore, ARN offers you both. You can schedule your sessions at home or in our center because we want to maximize your little one's learning potential.
Okay, moving on to the next slide. So yeah, before we get into Q&A, so as you can see, we've just summarized, but if you have any other concerns or questions, you can ask us.
Okay, Sara, there's one question about, okay, what type of cognitive test does my child need to take and when?
Okay, so in Singapore, there are two very commonly used IQ assessments. One is called the Stanford Binet 5th edition, and one is called the WIPC, which is a Wechsler preschool and primary school test of intelligence. So both, either one is fine. You can actually choose, I mean, depending, if you're going to KKH or hospital, the psychologist will just choose one of them. If you're going privately also, I think you can make an option, or it depends. So the IQ assessment, as I mentioned, is mainly taken when the child is about to graduate. Let's say is turning 6, and the year the child is going to finish preschool and enter into big school. So it is mainly to help the doctor understand. The doctor might request the parents to do it to understand your child's cognitive level, cognitive ability, and so to make a clearer decision. Is your child ready for mainstream? So let's say your child gets above average IQ, average to above average IQ, then definitely the chances of him being more ready for mainstream is higher. But I'm not saying it's not going to be challenging, because as I said, IQ is not the whole child. The child might have a very high IQ, but might have emotional regulation issues, might have behavioral issues, or might have attention issues. So it doesn't mean my child has 110 IQ, my child has a high IQ. Definitely mainstream is good. But it gives gives a better understanding. One factor definitely is cognitive ability, and so you know your child is cognitively ready for mainstream. But let's say your child gets a low or below average IQ, then definitely you would think twice, like, will my child be able to cope with the math, the English, the demands in mainstream? And would a school which is not so academically demanding be better? And then if the answer is yes, then you go for a spec school. So that's how you decide. And then we at ARN, we do provide some sort of like help in terms of coaching a child. If a child is about to take an IQ assessment, we coach the child with questions which will be similar to the IQ assessment, not like identical, obviously, because that would be ethical, but something similar, so that the child, when the child takes the IQ assessment, the child is a bit more ready for the assessment and is more aware of how to respond. And that will help the child in getting a better score. So I hope that answers the question.
Yeah, thank you. Okay, there's another question. Wait, okay. So my child is 9 years old. When she writes slowly, her handwriting is okay. But when she tried to write faster, her writing is quite hard to recognize. Her gripping is also not consistent. She repeatedly changed her gripping style. Okay. To answer that question, well, basically, what my suggestion is for the gripping, right? Maybe what you can do is prior to the writing skills, right? Try to develop more of the fine motor strength so that at least when he's required in school to write fast, it's going to be easier for him, okay? But again, it will take time also to develop those hand grip. You can do it at home, do different exercises like what you call this, the squeeze ball or the spray. You can make it functional wherein you're spraying the water. What else? Pressing using the clay. So those are the things that you might want to try. Okay, and then when you do the gripping, as you said, the gripping is not consistent. So maybe you can provide those pincer grip for the pencil so that it's going to be more stable. Okay, and then yeah, so for that one. So of course in school, if they are required to, what you call this, to write fast, of course the handwriting might not be that consistent. So what you can do at home for it to be consistent is try to practice it. Have some board work activity so that at least even if he's not in school, there's a task that he's doing at home so that at least he'll get used to doing it. Okay, so I hope that question and the answer, I was able to answer your question about that, the writing skills. Okay, so any other question? Okay, so there's one question. Which are the special schools in Singapore? Apart from Pathlight, where do I get the list?
Oh, okay. So the MOE website has the full list. You need to go to special education or special school, something like the choice will be there on the website. So Pathlight School is only one of them. There are quite a few, and they're not all autism specific. So some of them are only for children who are diagnosed with autism. But then there are special schools like Meta, APSN schools, which do take in children who may not be in the spectrum. So you need to just go to the MOE website and have a look at the full list. They do give you also the criteria for getting admission. That is the IQ score, the diagnosis. Based on all this, the child can get admission into the school. And so the next step would be, you go to the website and have a look at the full list. And then best thing to understand which is suitable for your child would be to go for an open house. If they have now, I'm not sure because of the whole COVID situation. But at least go to each school's website and have a look. Maybe if there's a virtual tour, and understand what each school's strengths are, and then find out which would be more suitable.
Okay, yeah, thank you for that one, Sara. So another question is, what does ARN do usually to help child to improve attention focus?
Okay. You want to answer that, Sharon?
Okay, yeah, okay. Basically,
I'll add to it.
yeah. Sure. Well, basically, we do have a lot of activities to help the child to improve attention and focus. Like for example, it really depends because attention focus is really what do you call this wide topic to talk about, because it depends on really on the activity, because it's not only about, is it about answering the question, is it about on the reading comprehension, is it about when the teacher is discussing the lesson, or is it when they're given multiple instruction. Okay, so in our end, definitely we do have different techniques on how to help them to increase the attention focus. Okay, we do a lot of visual performance activity to help them scan and attend to the tasks being given to them. Like for example, what do you call this, those sequencing activity, black imitation, that one really needs a lot of attention and focus when you're doing those activities. We also have what we call following eye gaze to make sure, are they really attending to the eye gaze of the other person? So those are some samples of the activities that we do. I don't know if Sara will have additional information about attention focus.
Yeah, I'll just add to that, add to what you said, Sharon. So main thing is we also work on increasing attention span. Like for example, sometimes when a child comes into ARN, in the beginning, he or she is not able to sit even for a minute. And the child is running around everywhere. And we initially start by letting him do that so that he gets used to us and likes being with us. But then once he's comfortable with the center and with us, slowly what we do is we increase the attention span by, let's say, making the child do a puzzle, let's say for 1.5 minutes or 2 minutes, and then immediately after 2 minutes the child is reinforced, meaning given a favorite toy or favorite activity which they like, and then slowly we increase that 2 minutes to 4 minutes, then to 6 minutes. So we're increasing the on-seat time, and immediately we follow it with the reinforcer. So that way we slowly increase the attention span.
Okay, thank you, Sara, for that additional information. Okay, there's one more, what do you call this, comment here. Because she misses the webinar, the 10 minutes, is there a place or link that she can catch up? I think you can watch it again on our Facebook account for if you miss the first 10 minutes of the webinar. Okay, yeah. So then there's another question here. Is it better to have an ABA therapist as a shadow teacher for my child? Okay, so that's a good question. Well, basically, okay, I'll answer for that one, right? Well, basically, first is the school open for a shadow teacher? Okay, that's the first thing that we need to consider as well. And then the next one, if it's an ABA therapist, of course, it's a plus that the shadow teacher is an ABA therapist, because the ABA therapists have an experience on how to modify the questions being given to the child, especially if the child is having difficulty, to troubleshoot on how to make it easier for the child to understand. And also, it's a plus because the ABA therapists have a background on how to handle the behavior, okay, in class. I hope that answer the question if it's, what do you call this, is it better to have an ABA therapist, okay? Okay, any other questions? Okay, there's one question. Okay, what to do if my child is, before have an ABA sessions, but because he's already in primary 4, so is it okay to go back to having an ABA session, even if my child is already in mainstream? What do you think, Sara?
I think it's absolutely okay. I think at any age, ABA verbal behavior can enhance the child's skills. If it does help the child, I mean, it's good, right? So it doesn't matter which age the child is at, which class the child is at. As Sharon mentioned, we work according to we keep the ables in mind. So wherever your child is, whichever level your child is, we will find the gaps. And if there are gaps, then we are going to target those gaps and work on those gaps.
Yeah, I think it's not because before you have ABA and now you don't have, and then you want to consider. I think the most thing that we need to consider is, does my child need extra help? I think you know, those what you call this, those extra help might be also useful, especially if it's more of like, again, as I said, troubleshooting of the behavior when it comes to if you, for example, they're okay with the lesson, it's more of the behavior that is having difficulty. Because as of the moment, we've been receiving a lot of clients who are been in the primary level already, but they do go and ask help from us, especially when it comes to the social skills. It's more of like making friends, because ABA doesn't stop only when they're during early intervention. Across the year, you will be able to use or effectively use ABA as a way of how to help our kids or our students. Yeah. Okay. Oh, there's another question. How to find a shadow for a child? Okay, how to get a shadow teacher for the child? So again, here in ARN, we are happy to help you, and maybe you can give us a call to get to know what specifically you are looking for, so that at least we can address the needs that you do have. Okay. Any other questions there? Okay, there's one. My child is doing good at school academically, but wait, the message is cut. Okay, academically, but he's having hard time connecting with his class. Does ARN has program for this? Okay, so again, I'll repeat the question. My child is doing good at school academically, but he's having hard time connecting with his class. What do you, I'm not sure about connecting with the class. Is it about making friends?
Yeah, I think maybe socially not being able to connect with his friends.
Yes. Oh, okay. Yeah, of course. Because does ARN has program for this? Yes, we do have program to help. Like, for example, if they're good with academics, if you want to just work on more of the social skills, yes, we do have a program. Yeah. So if you want to know more about it, you can ask. You can call the office to get more
And we
information.
have a program on social thinking, which is, I mean, depending on your child's age, we don't know how old your child is. So if it's an older child, we do teach social thinking, which is more like how to deal in situations, how to carry out social inferencing. All this is involved in social situations that will improve social skills.
Yeah. Okay. So yeah, I got the response. Oh, okay. So yeah, the child is having difficulty making friends, asking help from teacher, and more on the social skills. Yes. Yes, we are. We will be happy to help you when it comes to those concerns that you asked us. Okay. Yes, we do have. Okay. Any other question? Okay. Wait. There's one question. Okay, can a 16 years old adolescent with no therapy still benefit on an ABA therapy program?
I would say yes, of course. But Sharon, you go first.
Yeah, okay. Yeah, of course, as I said, it doesn't go with the age, right? So if it's an adolescent already, of course, we need to check first the skill level of the child, the current level of the child, right? Of course, if before he doesn't have any therapy intervention, yes, ABA can help, but again, it depends on the expectations that you might want to see. Like, for example, are we talking about a 16 years old who doesn't have a therapy? Is the question there is the child verbal, or I mean the client is verbal or non-verbal? How about the behavior? How does he communicate? How does he follow instruction as well? So we need to check on those things as well. So of course, we are happy to help to have an assessment on that case. Okay? Okay. Any other question? Okay, I think there's one more question. Do you provide what do you call this, the psych evaluation in ARN?
No, at the moment, no, we don't provide the evaluation, but we provide, let's say, we provide coaching, or we teach the child to be better prepared for the IQ assessment. So
Okay.
I have worked as a psychologist previously, so I do have experience with IQ assessments. So what we would do is teach the child certain items which are similar to the ones that come in the actual IQ assessment, and this will help the child to perform better in when the actual test is happening, when the actual assessment happens.
Okay, any other question? Okay. Do you have a school preparation program at your center?
You want to?
Okay, yeah,
I'll
I'll answer that question. Yes, we do have a school readiness program. Well, basically, even when our one-on-one session, right, we make sure that these kids will be able to be prepared in school, because as I mentioned from the first, during the introduction, most parents, that's what they want. They want their child to be in school. Of course, as part of the program in ARN, we always do have a school readiness program. And then beside the one-to-one, we prepare them for school. We also have a group class wherein it resembles the curriculum that they can do in school. So yes, we do have a school readiness program. Okay, any other questions? Okay. At what age does school preparation begin? I think I somehow answered that one, right? So basically, the curriculum, or the what you call this, the program that we provide for the kids, even when they start, even when they're young, 2, 3, 4, 5 years old, we always start to insert those skills that they will be needing in the school. As I mentioned, the whole ABLES is an educational assessment that prepared them to be ready in school. It will just vary, the program will just vary depending on the age and the current level of the child. So basically, that's why it's good to use the ABLES as an educational assessment, because it has normative data. So it will show you that a typical 2-year-old can do, a 3-year-old can do, a 4-year-old and a 5-year-old kid. Of course, if they are 2 years old, of course, they're not that ready for school yet. They're still young. Okay, so the skills, but definitely we do prepare them for the school. So to answer that question, at what age school preparation begin? Well, basically we start them on when they start with our program. Those skills that we're working on are towards for school readiness.
It's an ongoing process. It's not just that at 6 you know that your child is going to join mainstream, so at 5 we suddenly start
Yes, correct.
not like that. So from whenever they join us, we see how the child's level is and where the child has areas of concern or gaps, and then we focus on that, and then see how it goes from there.
Yeah. Okay. Any more question? Okay, I think we can have last question. Okay, how do you define school readiness? Why should parents consider school readiness for their special needs school?
Should I answer that?
Yeah, you can answer, yeah.
So I can't give you like a formal definition, but basically keeping Singapore in mind, we just help the child who is going to graduate soon. We are trying to find out if the child is ready. I mean, no child will be fully ready. Even let's say a K2 child who's going to go to P1 is not going to be fully equipped. A neurotypical K2 child is not fully equipped to know everything in P1. No, not really. But a child with special needs will find it even more harder, even more challenging than a neurotypical child to access mainstream curriculum. So we help the child get ready, prepare the child by giving a lot of academic like drills which involve academic problems, maybe math skills, numerical skills, and then we enhance the child's skills so that the child is more ready to join mainstream school. So that's the reason we need to have a school readiness program, so that a child who has got special needs, who has difficulty with attention, let's say difficulty making requests, let's say for example the child is not able to ask for help easily, so then we teach the child, we focus on that skill, we teach the child how to ask for help, and that is definitely going to help the child when he goes to a mainstream school.
Yeah. I think what you call this, there's a follow-up question about at what age does school preparation begin? I don't know if you're asking for the age, right? As what Sara says, okay, basically school starts at the age of 5, meaning what you call this, the preschool, you can start as early as 4 to 5 years old, okay? If you know that if your child have this problem already or have this, what you call this, challenges, or you know that, what you call this, there are some difficulties, then you can start early to catch up whatever delays that may have, to catch up those gap, as you say, in attending. Because this kid may not have the same way on to cope up the same with a typical developing kid. Yeah, but I hope I answer your question at what age, okay? So basically, even with the ables, right, at the typical 5-year-old kid, you know that you'll be ready for school. Because I don't know, Sara, what age does primary 1 here usually they start? 6. So I think the 4 to 6, of course, if you know that they have delays already, you can start early having an ABA program or a one-on-one, and then do a slowly transition to a school readiness, because these school readiness program are intervention, okay? Intervention program to assist children with unique learning and behavioral challenges. That's why we have this school readiness, okay? So definitely the school readiness will be able to transition them from what you call this, from a one-to-one, and soon, of course, on a mainstream school. Hopefully, that's our goal, is for them to be in a mainstream school. Who doesn't want to have their child to be enrolled in a mainstream school? I hope I answered the question about the age. Because as what Sara says, we cannot say that, oh, at the age of 4, we start them doing school expecting they will catch up the way that the typical developing kid. But if you see that there are delays already, then you can start early. You can start early.
School readiness can start the moment your child starts preschool.
Yeah,
that is
correct.
A school. It's
yes.
A school. So
yeah.
The moment your child is 2.5, 3 and has joined a preschool, and then let's say you notice that your child is having challenges in terms of following instruction, making friends. All these are also academic skills. It's not only about math, English, science.
Correct.
It's about following instructions, paying attention, being able to respond to your peers, being able to say no if somebody is bullying you, being able to agree or join a group. There's a lot of skills. So then it can start as soon as your child joins any school.
Yeah, correct. I agree to that one, Sara. Okay, to wrap up the webinar for today, well, basically, thank you for joining us. Yeah, so basically, if you have more questions, or if you have more clarification with the way we answer the questions, you feel free to visit us. You can call, you can give an email, you can visit our website, and also the Facebook page to see updates, because usually we post videos on how to improve writing skill, reading skills. So there's a lot of things that we can discuss with you. So we are here to help. So yeah, so just contact the office. The numbers are there. So yeah, thank you for joining. Sara?
Thank you. Thank you.
All right, thank you for joining us. And for next, we're going to have another webinar. It's about more of how to deal with challenging behavior. So basically, watch out for on our page, on our Facebook page, for more information about it. Okay. So thank you very much. Thank you for joining.